I got the doctor looking at me. He's almost looking too serious. I don't get many doctors with me. There he is. He's smiling now. Okay. I said, did I do something wrong, doctor? Hey, guys, welcome. We've got Amber here, along with 2.5-month-old.
Yep.
Wow. Benjamin, welcome to our Radiothon. I'll have you move up. I know you're holding there, Benjamin, there. And hello, Dr. Case.
Great to see you, Catfish. Thanks.
It's great to have you here. I know had a few minutes off this morning to come join Amber, right?
Oh, it's my pleasure. It's this whole effort really moves me. All these people working together to help the kids, and of course, Amber and Mike and Benjamin are very special to me.
You get close, very close to all the people you meet and help?
Absolutely. We care so deeply for these kids and for these families that we say right up front, we're going to take the doctor-patient relationship just to a little bit different level and make sure everybody's okay with that. But yeah, we care deeply for these families.
Yeah, I know you guys do. It's just I've been a part of this for 9 years, and it's just amazing. Everything that just oozes about family and help, and like we said, not just the medicine and the procedures and the surgeries and all that, but it just goes way beyond. It's unlike any place that I've ever seen, and I'm sure a lot of the people that come through here. And it's good to have them. Good to have them here. And we're going to talk about you, Amber, and you got a smile on your face because things are going better. I see, as a disc, I can't even pronounce this, congenital
diaphragmatic.
There you go, hernia, which is very scary. It is life-threatening right out of the chute. First baby?
6th.
Wow. Wow. Oh, wow. Well, congratulations on all 6. And wow. I mean, I'm just thinking you've got your hands full. My first thought was, and then you've got a baby that's very, very sick. Take us from the beginning.
So it was definitely a surprise. We found out at our 20-week ultrasound that he had CDH, and coupled with a few other things, they only quoted us a 20% chance of survival.
All right.
They offered termination.
Right. Oh my goodness.
Yep. So
I do hear that because I know some of this with some of the other patients that I've interviewed over the years. This is Dr. Case. This is something that, like I said, a lot of people, a lot of areas just can't handle, and they just say, "Hey, look, it's better to." Like you said, termination. But you guys, it's different here. I mean, you guys have a big success rate for this. And what do you say to that when you hear somebody come to you with this?
Well, it's actually a very consistent story that patients are diagnosed before they're born with this condition, congenital diaphragmatic hernia, and very well-meaning physicians say, I'm so sorry, your baby's going to either die or have a bad outcome, and we can schedule your termination right away. And I have no idea how many babies are terminated, but I need to let people know that here at the Johns Hopkins Children's Hospital, the results are astoundingly different from what's going on in the national conversation. And Amber and Mike came from Utah, and they were told 20% survival at their home institution. And what did we tell you about his chances of survival if cared for here?
95%.
Whoa! Yes.
A big difference.
Wow! All the way from Utah.
Yeah.
So how'd you find out about Johns Hopkins and Dr. Case?
Well, funny enough, a couple different ways. So we found out, and we immediately started doing research and looking at other options, and Case kept popping up. He popped up in the video from the Radiothon last year, so we watched that clip.
All right.
And he was on the magazine of the For the Kids from the hospital. And we saw him in a couple other areas. We read some articles, and we thought, he's too good to be true. He's got to be fudging numbers or showboating or.
I was going to say, plug your ears, Dr. Case. Superhero.
He's heard it before, I'm
Superhero
sure.
in the flesh, right here in St. Pete.
Well,
anyway.
It's true. You know, when everywhere else you're getting quoted, 50% as a positive, and we're already sitting at 20.
And it's a race for time for you and your husband. You're thinking, oh my goodness, we're gonna lose this baby. They want us to terminate this baby, but now we have hope.
Yep. So we came out here for a consult from Utah and met with him and ran some tests and just felt amazing about everything. Had, a really good feeling about him and from his team right from the very beginning. We sat down with him and first thing, and I think he does this with most of his patients, he sat down and asked us the baby's name. And it always brings tears because so far your baby's just been a statistic or a number or, it's already looked at something fatal. And so for the first time it was someone having hope and giving us hope, and very, very confident in we can not only save him, but we can help him have a good quality of life. Because that's what we
God
wanted.
bless.
We didn't want him just to be saved, but we wanted him to have the best quality of life afterwards that he could. And the way that these babies are cared for, that matters. That matters how they're affected long term. And Dr. Kays puts his whole heart and soul into his program and his plan and watching these babies and taking care of them through the whole process. The continuity of care is something that appealed right from the beginning, and that's what we got. From the day we came for our first meeting until, follow-up that we had with him just yesterday, and that we'll continue to have, for the weeks and months and years ahead.
So this has been obviously only 2.5 months old. So you've been obviously here, the whole time?
Almost.
So, just about.
We've not been discharged quite 2 weeks yet. So, yep.
Are you going to move here now, where it's a little bit?
We did, yeah, because we've got the other kids. We couldn't just relocate for a couple months, so we full on moved.
You want to live in Dr. Kays' neighborhood there? You want to be close to him. I mean, I would
house,
too.
Does he have
Yeah, and and there's a lot more sun here. Not that Utah is a bad place, but
I love Florida.
I know.
I'm sold.
Wow. While you're listening to this, you can always call 1-800-270-8642. Oh man, and Dr. Kays, for our listeners that don't know, I think it's a fair question. What exactly did Benjamin have? What do these babies have? Why it's so bad that a lot of them want to terminate, or they suggest to terminate?
So congenital diaphragmatic hernia is a hole in the diaphragm, that muscle between the abdomen and the chest, that occurs early in development. And so abdominal contents, stomach, spleen, intestine, and liver move up into the chest during development and severely compromise the growth of the lung on the affected side, and push the heart over to the other side, so the lung on the other side is compromised. And national survival rates are somewhere in the 50 to 70% range. We have no idea how many babies are terminated, but it's just really clear that the survival percentages of these kids, if cared for in the best way possible, can so far exceed what people believe that what happens is nationally we get the same kind of reaction that Amber gave, which is it can't be true. They must be fudging their numbers or something like that. But I'll say clearly, we've now had 40 consecutive unilateral diaphragmatic hernia babies survive at the JohnsHopkinsAllChildren'sHospital. That's never occurred anywhere, and the results are just different. And we care about these kids, we believe in them, and we're going to keep fighting for them.
Wow. What a compassion, and just that's just absolutely amazing. And it never ceases to amaze me. The people that work, I don't want to call it work, they're just performing their magic and their heartfelt procedures here at All Children's. And now I lost my train of thought after that. But, with Benjamin now, the prognosis from this point forward now?
He's going to have an outstanding life. I think this child is essentially normal. He had some difficulties with feeding that we had to deal with, but guess what? Those are going to be overcome over time. His brain is good. We know clearly that how many kids we save with this disease is about how well we take care of their lungs. But the quality of that survival is about how well we take care of their brains. And we think about their brains every minute of every day. And so not only is the number of patients that we save very high, but the quality of those outcomes are very high as well.
Wow. Thank God for the internet and videos and all that. I mean, people, you think about that. How would you find, it's hard to find someone like this guy in this hospital. I mean, it's absolutely amazing. So, I'm glad that you guys got hooked up.
Well, yeah, and that's why it's important for events like these, because that's what first put us onto him and helped us get to where we are.
Yeah, that's great. How's the rest of the family doing? I mean, you got the 5 other
They're
kids.
They're doing good. They're happy to have him home. They have been adoring him nonstop. So
it's going to be exciting to watch him grow up and be a part of your family, isn't it? I mean, that's going to be really cool. I know I asked you, but I'm just so mesmerized by all this. But you said you are moving here?
We did.
Yeah. Oh, yeah. Okay. Yeah.
So before we had him, we moved.
I'm on cough drops or something there and anything. Dr. Kays, let's speak real quick. It becomes redundant, but it needs to be heard, and I want to hear from your side. There's people that kind of on the fence, or they get busy and they don't get around to calling and helping today. And we, if they ever need this place. I mean, it's really, let's call it what it is. It's an insurance policy, whether you've been here or not. And why people should call and donate and make this one of their charitable contributions, because we're in a world that there's a lot of hands out.
Well, And that's a really good point. And for the families that have children that have medical issues, they totally get it. But I really want to reach out to all those families right now that have healthy kids and give them a hug, give them a kiss, be thankful for them. And this is the time to reach out and say, I'm so thankful my child was healthy, but it might not have been. And reach out and support the Johns Hopkins All Children's Hospital. This is something very important. Be thankful that your kid is healthy. And I'm so moved by all this and all these people that I'd really like all those people with healthy kids to call in, and I'm going to personally pledge $2,000 right now because I believe so much in this.
Wow. Well, thank you so much. It's very generous. You're quite a man. I got to tell you what. Thank you so much. It's just, I know you're just one of many that do the special work there, but it's really cool to hang out with a guy like that, right?
Well, and you don't get that anywhere else. Where are you just sitting with your surgeon that saved your baby's
Exactly.
life, And
Yeah.
it's amazing.
Well, I thank you so much for sharing your story. It's emotional. It's awesome. And hey, welcome to Florida. And I hope that are you gonna have any more? I shouldn't be asking.
It depends if you ask me or my husband.
Hey, I hope the best for everything. And I'm so glad you guys are doing well. And like I said, I did interview. I just go back to I can't remember their name. There's a lady in Indiana that I interviewed last year that had the same thing, and I think even more intense in some areas, and they're doing well. So I'm just astounded how the miracles. When we say that, we're not just giving lip service here. Sure, not everything happens the way you want it, but the survival rates and the magic and the miracles are happening more and more. Percentage rates are way up there, and it's like I always used to joke around, but then you'd be out of a job if we could just, everybody was well and there's no cancer and stuff, we could turn this place into a big amusement park. But that's not going to happen. Yeah.
Right.
But until then, we got Dr. K's, and we got a very successful outcome here for Benjamin. Thank you guys so much for being here.
Thank you.
Thanks.